Hello, so I'm going to do a short vlog over what we learned in class today, this week. And in this vlog, I'm going to be talking about the core values of social work and how they can unfold in practice, specifically in applying ethical standards to children and adolescents. So there are 6 core values to social work. The first is service, which is the primary goal of a social worker is to help people in need and to address social problems. And if you elevate service to others above your own self-interest, this can unfold in practice where if you need to go a little above and beyond your primary duties to help someone, for instance, if you're a micro social worker and implementing a macro practice or a solution could help your specific client, then that would be something that you would go above and beyond your time to accomplish, and it would help. It would be of service to your client and also the community. The second is social justice. Social workers pursue social change and on behalf of vulnerable and oppressed populations and individuals and groups of people. So this is just more like an advocacy standpoint, and this could unfold in practice in many different ways. For example, if you're working with a disabled person, a person with different abilities, and they need access to a building, and the building does not have, the proper access points for them. It doesn't have like the push to open doors or a ramp, or perhaps it doesn't have like the buttons on the sidewalk to help people that can't see. Then you can advocate for this person, which is also more of a macro. So the micro and macro do influence each other a lot in this value as well. The next value is dignity and worth of a person. So you have to talk to people in a caring and respectful manner. You want to make sure that you respect people's dignity and you show them that they are worth something. And this can be done in individual practice by simply active listening and reciprocating and acknowledging how they feel and what they say. And their views also, just like take in their views unbiased. The next value is the importance of human relationships. So social workers recognize that human relationships are essential to well-being and mental health. They're important for a vehicle of change. So you use people. You can use a genogram when you're talking to somebody and find out just who their support systems are. Do they have family close by? Do they have friends close by that they talk to, or church groups? These interactions with each other are actual supports that people already have. They just don't realize that they have, or maybe they don't know exactly how to tap into those resources. The fifth value is integrity. So you have to behave in a trustworthy manner. So you're aware of the profession's missions, the values, the ethics, and you practice consistently with them. You have to be honest and promote ethical practices. This one is a little harder to explain. Integrity, I would say, in like an individual to individual basis would be keeping confidentiality and explaining to your client just what you can keep confidential, what you are mandated to report, if a court ordered were to come up, what the judge can see, what the lawyers can see, what CPS is going to be able to see if they are involved, and just certain things like that. The last value is competence. So you have to practice within your area of expertise, your area of competence. And this is just basically don't bite off more than you can chew. If you don't know how to address something, if somebody comes to you and you're not sure about mental health or substance abuse, that's not like your specialized field, and you don't have a lot of knowledge or you don't know where to find research about it, don't act on what you barely know. You need to research, you need to talk to other professionals, and maybe sometimes maybe even pass that client to somebody who is more knowledgeable and can help them better. The next thing I want to talk about is the complicated process of applying ethical standards to children and adolescents. So, for one, safeguarding and self-determination for minors is a complicated process because in most states, minors are presumed to be not of decision-making capacity. You have to take into consideration the rights of the parent as well and really focus on who you're giving services to. That is the biggest thing. So, especially in the child welfare system, because children don't speak up for themselves, maybe they don't know how to speak up for themselves properly, the parent is often looked at as, oh, well, the parent knows best, but that's not always the case. The parent or guardian doesn't know everything that's happening with the child. If the minor is at an appropriate developmental stage to reason and is cognitively able to process decisions, it's important that the social worker allows them to make the decision on their own and guide them as if they were an adult. Just treat them like a regular person. If you allow them to make decisions on their own, you have to still keep into account that, their cognitive ability, their developmental stage, and you also have to take into account the parent's obligation to the child as well. Another factor you have to consider when working with minors is that if they have the ability to understand informed consent or not. Because the parent or guardian of the minor is presumed to have the child's best interests in mind, they're the ones to choose the intervention method, amongst other things, during therapy sessions. And it's important that if the minor you're dealing with can understand informed consent and can understand the intervention methods, that you explain it to them still, and you ask them, how do you feel about this? Are you comfortable with this? This is the method that we're deciding to choose to use. Do you think that this would help you? And you still give them the ability to choose for themselves. Maybe they don't feel comfortable with that. Maybe their parents were wrong. And that is all I have for today. Thank you so much for stopping by and listening.